50% of the counties in the United States don't have a single psychiatrist. And there's especially a shortage of mental health professionals who specialize in working with young people.
It's also really challenging to know who to turn to, who to ask, even to identify what's specifically wrong.
What we're seeing a lot of is isolation, loneliness, social anxiety, burnout, imposter syndrome.
What we're really noticing is that the world that we live in is being fractured by an invasion of technology. And a big part of what HealthyGamer helps people do is reconnect. And then what happens is 50 to 60% of the population has one of these manifestations. HealthyGamer is a digital mental health platform that's designed to help especially young people with the problems of the digital age. At HealthyGamer, we do three things: content, community, and coaching. One of the ways that we try to make mental health education entertaining and accessible is through platforms like Twitch and YouTube. So we recently had a Twitch stream where there were 14,000 people who came to a lecture about the basics of trauma. We have different kinds of community events like Social Sandbox where people can come and practice social skills. This past Valentine's Day, there were 300 members who got together to practice asking each other out on dates. And we also have month-long challenges like Touch Grass, where we encourage people to go out and do things like meditate in parks or go for walks and things like that. Some people want more comprehensive mental health resources, which is why we built things like Dr. K's Guide. So if they're interested in learning about meditation for depression, they can watch those videos. If they're even interested in evidence-based complementary and alternative medicine for things like anxiety, they can watch those videos. So taking psychoeducation topics and stringing them together in a way that a user can navigate their own journey.
We think it's really important to meet people where they're at, in their language, in their online spaces, where they're talking about their anxiety or their isolation or their loneliness on places like Reddit, places like Discord and Twitch. That's where we want to be. We want to spread psychoeducation about different mental health conditions to 10,000, 100,000, 1 million people in one shot. And the more we did that, the more we saw, wow, there's a lot of power in doing things collectively.
It's an essential cornerstone of helping people grow and helping people find this information is making it digestible, easy to find, and come from somebody who makes them feel comfortable and entertained. And just because you're a doctor or just because you do school talks and things doesn't mean necessarily that you know how to be entertaining or charismatic or hold people's attention or are culturally relevant right now. And so even though they had everything right to say and it came from such a wonderful source, it just doesn't reach anybody. You create a resource that can support people and reach people in their homes when they're alone and when they need the most help. And it's not just reducing things like loneliness, anxiety, depression, and mental health issues. It's also increasing bonds. It's also increasing quality of life.
The whole thing over here is going to be hugely helpful. These are like the extras.
The third area that we focus on is coaching and peer support. Psychotherapy may be able to help with pathology, and we can get a lot of yield with things like psychopharmacology, but patients also need skills training. They also need peer support, and that's really where we come in.
The HealthyGamer peer coaching program is available currently in 118 countries. We have a matching program where we will match you with a coach, and then pretty quickly you will be able to meet your coach. All of this is done virtually online. We address more of the day-to-day solutions. So our coaches will focus on things like skills and psychoeducation. We offer a personal mental health coaching, as well as coaching for careers, creators, and a program for parents of gamers, a coaching specifically developed for parents. All of our coaches have lived experience. They are mostly also gamers. They are of the internet generation, so they're able to develop a rapport and a connection at a different kind of level than with a clinician.
Coaching really is a subset of professional mental health treatment. It's the part of mental health treatment that we refer to as supportive therapy or facilitated treatment or goal setting, or even some aspects of behavioral and cognitive therapy that can be provided one-on-one, even more efficiently in small groups. And that is what HealthyGamer does well with its special focus on the internet generation. So this preclinical approach can be easily and widely provided. It can increase well-being, help people improve their functioning, provide an early intervention even to curb the development of some more serious, clinical level mental health disorders. And well-trained coaches can also help persuade otherwise reluctant clients to take a step into professional treatment if necessary, sometimes a very difficult step. This can be a platform to help make that bridge.
I love to see a reduction in stigma for the mental health industry in general. A lot of our clients cannot access their own mental health care in a formal setting, so coaching is kind of a good way for them to get an idea of what treating their mental health might look like.
What's next for HealthyGamer is working with parents. What we're hearing more and more is that parents don't know how to raise children in this invasively digital age. And so we're really looking to educate parents and teach them new skills like healthy boundary setting. Which apps are okay to use and which apps aren't okay to use. How much TikTok is too much TikTok? What's a safe level?
Parents are kind of in their generation of technology and in their kind of circles. Meanwhile, their kids are getting further and further away in the content they're consuming. So all we're ever really trying to do is get people on the same page to be part of the solution kind of day in, day out.
There is a huge movement for better mental health, for breaking down social barriers, and I think it's creating a huge cultural shift, and it's been beautiful.